All right, hello everyone.
Hi everyone.
Hi, everyone.
Hi. Okay, so I think this is everyone. First thank you all for joining the seminar. Before we start, I just kindly ask that you keep your mics muted throughout the seminar. So the way this is going to work is that the hosts, me, Ayush, and Sid, will be asking 12 main questions to Arnav, who is our speaker. And it'll be about the medical field. And after we finish those questions, then we leave it up to the audience to ask their questions to Arnav. And during that time, you can raise your hand either virtually through the Zoom option, and the speaker will either pick on you, or you can unmute and ask your question if the speaker picks on you. Another option is using the virtual Zoom chat. And yeah, that's pretty much it. So my name is Kevin Fernandez, and I'm a junior at South Brunswick High School. And I'm the co-founder of Prepinar, along with my two friends, Ayush and Sid.
Hi, my name is Ayush, and I'm a senior at South Brunswick High School.
Hey, I'm Sid, and I'm a junior at South Brunswick High School.
So just to give like a quick, brief explanation about what Prepinar is and the mission of it, it's basically to assist students to figure out a solid path for their futures. And because in society, we all aspire to attain goals, and we put our strongest efforts to try and achieve our goals. But most of the time we encounter obstacles and doubts that can get in our way. So at Prepinar, students have opportunities to listen and ask questions from other students who have already excelled and achieved their desired goals. So this in return will help and aid students find a path for their future. So to not take up more of your time, I introduce you to our speaker, Arnav Pondicherry. Okay, so now we're going to start our 12 questions.
Okay, hi, Dr. Arnav. So the first question I would like to ask is, what is the toughest part of pursuing the medical field?
I would say there's probably three parts to that question. The first is the long hours and the very demanding nature of the field. I think it's well established that doctors work long hours, and I don't think there's a single subspecialty of medicine which doesn't involve spending a significant amount of time either in the hospital or doing a lot of studying on the road to becoming a doctor. So that's probably the most difficult portion of it. Second is that you're interacting with people in the hospital, and you're often seeing them at kind of a very difficult point in their lives. And that can be challenging. It can be emotionally taxing. And then the third part is that you're occasionally confronted by death, dying. It's part of the field. And of course, that can also be emotionally draining.
Yeah. So when you're pursuing the medical field, what are some specific goals you should aim for, such as academically?
So I think that in terms of general academic performance, your standard stuff like when you're in high school or when you're in college, focusing on your GPA is important. Doing all of the prerequisite courses that you need in order to apply for medical school. And then there's a whole bunch of different standardized testing along the way, like your Mcats and the various board exams. Extracurriculars are going to be really important though. So I would say that research experience and publications are a big piece of any sort of med school application. And really doing stuff outside of the book work is what's going to differentiate you as an applicant and as a candidate. So having good, clear research interests, and then also other things that you do outside of academic stuff that you just do because it's fun or interesting to you. Oftentimes when it comes to an interview, those are the key points that people focus on rather than the book work. So that's really going to become important when you apply. And then the final thing I would say is perspective is really important. So I think there's a lot of tendency to try to rush through because it's such a long process. But like people will do these shortened training programs that try to finish in 6 years or 7 years. And that's all well and good, but I think that you miss out on the perspective of seeing what the field is really like and then exploring your other interests on the side, which is equally important. So I would encourage people not to try to rush through the process too.
Yeah. And can you give us like a pros and cons list of like the medical field as a generally?
Sure. I think the biggest pro of medicine is that it's a super interesting and dynamic field. It's always changing and it has really important implications for everyone involved. I mean, all of us are human beings, all of us have health and health concerns, and healthcare affects all of us individually. And so we should all be like educated consumers of healthcare, as well as just know how to take care of ourselves generally. And I think because of this, there's very few other fields that generate the level of interest and scrutiny, the controversies. Because of all the money and effort involved, there's a lot of cutting edge research and technology. And medicine also exists at the intersection of various other pursuits like the law and politics, science and finance. So I think that it's really an interesting and kind of constantly evolving place to be. On the flip side, there's a lot of complexity, there's a lot of administrative burden that comes with being a doctor. Patient care is really fun, but outside of the patient care, there's a lot of other responsibilities you have to attend to, like billing and documentation, and all of that stuff can be burdensome at the end of the day. There's also a lot of pressure nowadays as well, as in order to see as many patients as possible and kind of generate as much revenue as possible, which takes away a bit from the interpersonal dynamic that I think a lot of people go into the field for.
And what do you think about taking a gap year after you complete your education at an undergrad college?
I think that could be a very worthwhile experience. As I mentioned before, this idea of perspective is really important, and a gap year gives you a great chance to obtain more perspective. If you're not sure about medicine, you're interested in other fields, you get the chance to explore that. I took an extra year of med school. So my 5th year of med school, I did at another institution because I was interested in a specific type of research, which wasn't offered at the place where I was going to school. And it was a great experience. I learned a lot, and it actually made me a better candidate as well when I was applying for residency. So I think there's very few downsides to doing that extra year.
Okay.
Okay. Hey Arnav, thanks for joining us. I have a few questions for you too. And one of them is, why did you choose to pursue medicine?
I think there's a lot of different aspects to that choice. It really started when I was younger. My primary role model was my uncle, and he wasn't a medical doctor. He was a research doctor who studied breast cancer, but he was the one who first got me involved and interested in the sciences. And then as I went through that process of exploring that interest, I realized that medicine was the best way for me to combine all of my various interests. So you've got the aspect of human health and longevity, you've got the scientific aspect, technological aspect, and then also business, because there's a lot of money and finance that goes into healthcare as well. So it was a pretty winding road. I wouldn't say that it was straightforward by any means, but where I am currently, which is more than halfway through residency, which is probably the most challenging part of becoming a doctor, I would say that I'm very satisfied with the decision.
Okay. Also, so you said your primary role model was your uncle, right? Okay, that's very nice. And what are some classes that someone should take in high school or college that are better for pursuing medicine, academic-wise in general?
I would say for high school, you don't have to worry too much about that. There's nothing really that you can take in high school that will either make you a better candidate or kind of like show you something that's so relevant to the medical field that would make you either super interested or disinterested in it, other than what's already covered, like your typical science and biology classes and stuff like that. So I would say just do what's interesting and available to you. It's similar in college, except there are now some requirements that you need to meet before you get to med school. Like you have to take organic chemistry, physics, some language classes, all those kinds of things. But apart from that, I would say that you don't want to become too narrow focused. Again, this idea of perspective is kind of a constant theme. You want to take things that are interesting to you, explore as many sort of broad fields as you possibly can. For instance, I was a biomedical engineering major and a Latin major with a minor in mathematics. So pretty different stuff. Most of my classes didn't have a lot to do with medicine specifically, but that gives you something interesting to talk about when you're interviewing and applying. So yeah.
Okay. Any unique clubs or activities that someone should look out for if they're pursuing medicine?
I would encourage everyone to at least do something research related. That's not to say that everyone's going to become a researcher, but everyone should understand how the process of science works, especially as it relates to medicine. That being said, research is a very diverse field in and of itself, and there's always something that you can find that matches your interest that is involved in research. So you don't have to focus on any one specific type. You can do just some sort of scientific pursuit that's related to whatever your interests are. Apart from that, I would say really just having as many diverse extracurricular interests as possible. You'll see a lot of people who kind of do a sort of formulaic thing where they go to this specific medical interest group, or they're on this very focused on medicine, which is fine, but a lot of other people are doing the exact same thing. So in terms of trying to differentiate yourself, it's not an easy way to go. So I'd encourage you to just do whatever's interesting to you and use that as a topping point.
Okay, so also like setting yourself apart, basically.
Yep, exactly.
And how would I choose like the type of specialty that I want to pursue? Like, for example, if I want to become a surgeon or a pediatrician, etc.
So that's a really challenging question. I think most medical students agonize over that for most of med school. So it's not something that I feel like very few people know right away when they come to med school what they want to do, or even before that. I came in thinking something neuroscience related, and I guess going into psychiatry, I did stay sort of in that track. But I was more interested in neurology coming in and then switched. So I would say that's pretty common for people changing which specialty they pursue. The decision of what specialty is very particular to who you are as a person, what your specific research and the clinical interests are, what kind of work-life balance you want to have as a practicing physician, and the characteristics of the field. And like for me particularly, I chose psychiatry because of the neuroscience interest, but also there's a lot of psychological and philosophical aspects of psychiatry that you don't get in many other fields. I also enjoy spending a lot of time with patients, and psychiatry is probably one of the best places to do that. And it gives you a good work-life balance at the same time. So those were three of the main factors that led me to choose my specialty.
Okay.
Okay. Yeah, hey Arnav. So it's been really great so far. So just to let the audience know, I'm going to be asking 4 more questions, and then we're going to leave it up to you guys to ask questions that you want to. So to start off with my first question, it is like, what are some useful tips for studying efficiently for the MCAT?
So it's another tough question. It's been a while since I've taken the exam, and the test has changed a lot since I took it as well. I think that general principles of preparing for not just the MCATs, but also your board exams is principles are more important than facts. I think that if you spend time sort of memorizing facts, you may be able to do it if you have a great memory, but in the long run, it doesn't teach you as effectively as you want to. And I think tests are ultimately about learning the information so that you can apply it in practical settings. This is really especially true of the MCAT, which is very little fact memorization and is very sort of principle oriented. Some just general tips as far as test taking goes, I would say that you have to give yourself sufficient time. That'll be different for different people. Try to create a study schedule that kind of lays out very specifically what you're going to be doing on what day and leads you up to the exam, and then execute that schedule with as much focus as you can. And I think that'll generally take you where you need to go.
Great, thank you. And the second question is, how would I know if I really want to pursue medicine?
I think that's a great question. And I would say that experience, again, this idea of perspective is the most important thing. So you need a lot of experience, not just doing healthcare related stuff. Like a lot of people will volunteer in hospitals or do some sort of healthcare related work. And that's really important. You want to get a really good sense of what does it mean to be a doctor, not just in a theoretical sense, but what does the day-to-day look like? And then the second piece of that is knowing what are other fields that I potentially am interested in and what do they look like? And if you've got a good understanding of both and you feel like medicine is the only answer for you, then that's a good sign that you want to be a doctor and should be a doctor.
Thank you. And so how would you go about implementing your idea of, you said your integrative research and technology in medicine?
I think my current lab work is a good example of this. So I work at this center where we use technology to advance behavioral health understanding. And so we create mobile applications, we use wearable health devices like smartwatches to gather data from patients regarding sort of biomedical information like vital signs, heart rate, those kinds of things, in addition to other information that's available on your phone, and use that as a means of predicting mental illness and potentially introducing treatments to those predictions early in the course. I think that the major issue with medicine nowadays is that we're really poor at treating chronic diseases. And a lot of healthcare dollars are wasted in the treatment of chronic diseases, and we do it very ineffectively. And the future of medicine, I believe, is going to be preventative. So being able to use complex algorithms to diagnose conditions well before they become significant issues, and then implement treatments at that time when they're much more effective.
Thank you. That's actually really interesting. Yeah, so for my next question, it is when applying for medical school or residency, like what do they mainly look for?
Some of the stuff we've discussed so far, so there's your general academic performance, which includes your grade point average, your class-specific work, and then any sort of board testing or Mcat's standardized testing that you do. Then in medical school, there's an additional element of clinical performance that's added on. In your third and fourth years, you spend most of your time rotating through various specialties and subspecialties. And how you do in those rotations typically is a good gauge of how you'll do performing as a resident in those specialties. So you definitely want to do well. Like since I went into psychiatry, you definitely want to do well in any sort of subspecialty related to psychiatry when you're rotating through your medical school years, just as an example. Then, of course, there's the extracurricular aspect as well. So the research that you do, and then any sort of general things that make you interesting and well-rounded as a person. Because ultimately, medicine is a very human field, and anything that gives you the ability to relate to people more effectively is going to make you a better doctor.
Great, thank you. And yeah, so that's pretty much it from the host for our questions. So now, you guys, the audience, you can ask your questions, but we just please ask if you can raise your hand through the Zoom option, and then Arnav will pick on you. Thank you. You can also use the virtual Zoom chat if you want to.
Looks like we have a question from Miranda asking, what are fellowships? So the way that medicine is structured, there is your specialty, which you apply into when you apply for residency. For example, you can apply into internal medicine or general surgery or psychiatry. Fellowships are the next stage of that. So after you complete your residency training, you can choose to do a super specialty on top of that residency training, which is called a fellowship. For example, in psychiatry, some subspecialties of psychiatry include child and adolescent psychiatry or consult psychiatry. So fellowships are typically 1 to 2 years in length, and they give you an additional certification on top of your basic residency training. We've got another question from Arunima, and it's asking, what are all the standardized tests you need to complete to qualify for med school? So going back to college, I think that's the more salient place to focus on. Really, the Mcat is the only test that you need to qualify for medical school as an undergraduate. So obviously on the way to becoming an undergraduate, you do a whole bunch of standardized testing like the SATs or ACTs and those kinds of things. But when you're an undergrad, the only thing you actually have to do is an Mcat to be able to apply. And as a follow-up, is it beneficial to work at a teaching hospital? I think that's an excellent question. So just to give people some perspective, there's 2 basic types of hospitals. There are teaching hospitals, and then there are more community-oriented hospitals where the focus is less on residency teaching and more on just delivering care. And I would say that the academic centers, the teaching hospitals, are really the best place to get your training. It may not be the place that everyone chooses to work after they finish their residency, but the beauty of the academic center is you're exposed to other very interested and intelligent people. You're doing a lot of research, and you're also exposed to ongoing research at the facility. There's usually a whole bunch of different specialists, so there's a lot of back and forth about different specific aspects of medicine. It's really a very rich learning environment. So I would say that you definitely want to do your residency training at a teaching hospital. And when you work, if you enjoy teaching, then I would definitely recommend staying at a teaching hospital. Another question from Anshu, apart from research, what clubs and extracurriculars were you involved in? So when I was in undergraduate, my primary interests were, I did Taekwondo for all 4 years of college. So I would say that doing any sort of sport is really a good way to not just build your physical health, but then also give you a lot of really good connections. And it's also a very good way of portraying yourself to a committee where you're applying. So I would definitely say something physical, some sort of sport or musical activity. That was the primary thing for me, because a sport can take up most of your time. So really between the two majors, the sport and then applying for medical school, I think that was my major involvement in undergraduate. Then the next question from Miranda is, any tips on taking the USMLE exam? So to give folks some additional perspective there too, if they're not aware, there's 3 different types of USMLE exams. They're called Step 1, Step 2, and Step 3. And each of these you take at different points in your medical training. So you take your Step 1 at the end of your 2nd year of medical school, typically. You take Step 2 usually between 3rd and 4th years. And there's a couple of different parts of Step 2. And then Step 3 you take after you finish your 1st year of residency. And as far as tips for taking the exam, these are really long, draining tests. Typically, they're full day tests. Again, just my general tips on taking exams. You want to really give yourself sufficient time to study, especially for Step 1, because it's by far the most difficult. You want to make sure you have a couple of high quality resources, but I would advise you not to go overboard. So most people tend to focus on 1 or 2 key resources, one of which is an informational source, and then one which is a question-taking source. Usually something like UWorld, that's the primary question-taking source, gives you really high-quality questions that closely resemble the actual exam. So setting enough time, having good resources, and then executing on the study schedule you put forward.
Just to let everyone know, it's unfortunate, but Zoom only allows us to have 40-minute meetings. So we have like around 8 minutes left. So we can still ask like a couple more questions for Q&A, but just to let you know, we will be ending the seminar soon with a conclusion. So try to get out your questions now. Thank you.
Thanks for the heads up, Kevin. So Sally's question is family medicine or internal medicine better for residency to specialize in psychiatry and or neuroscience and cardiology? I'm not sure if I'm understanding this correctly. I think there potentially is a misconception there. So when you're applying for residency, you can apply into either family medicine or internal medicine or psychiatry. Typically, like psychiatry isn't a specialty on top of those things. So you would be picking one or the other. Cardiology, on the other hand, is a fellowship. So cardiology is an internal medicine fellowship. So you would need to complete an internal medicine residency in order to then apply for a cardiology fellowship. So there can be some intricacy in terms of which specialties there are and what you can apply to afterwards. And there's another question, do you earn more money depending on how much education you have? Generally, yes. The longer the residency, the greater the pay, your general salary is. So specialties like surgery tend to have longer residencies ranging from 5 to 6 years and potentially even longer. In comparison, psychiatry is 4 years. Things like pediatrics, internal medicine are 3 years. So generally, the more specialized you get, the more training you get, the more money you will earn in the long term. Pooja's question is, what tips would you give for interviews for the med school application process? I would say apply broadly. It can be challenging to hear back from med schools. So I would say that err on the side of applying to more schools than you think you need. And then when it comes to interviews, your best source of information are your extracurricular activities. So nobody's going to ask you about the class you took that everyone else took. They're going to ask you about the really interesting thing you did, which was completely unrelated to medicine. So I would say focus on those extracurriculars and making them interesting and diverse and rich. And one more question, does specializing in cardiothoracics require an extended amount of education? And the answer to that is yes, but less so than previously. So in the past, you would need to do a general surgery residency for 5 years, and then do a fellowship in cardiothoracic surgery. Currently, they've changed it so you can apply directly to a residency in cardiothoracic surgery. So it saves a year or so, but it's still a long process. So it's at least 6 years as far as I know.
Devontae, do you have a question?
Yeah, I have a question. My question is, in college, many students said that organic chemistry was a very tough course to take, and their undergrad. How was your experience taking the course, and can you please give me some tips doing well on this course?
Sure. So organic chemistry definitely has a reputation as being, if not the hardest, one of the hardest classes as a prerequisite. I would say that the reputation is well deserved. It is a really challenging class because you're memorizing a lot of information. I would say it's a pretty close approximation to the kind of memorization you do in medical school, where there's just a lot of information that you have to absorb in a quick amount of time. I would say flashcards are your friends. So when you're studying organic chemistry, try to make flashcards out of the reactions, out of the various molecular structures, and then drill those flashcards. And that's a much better way of learning than just trying to read through the text repeatedly. And then practice doing questions, drawing out the structures from memory when you have the chance. Got another question from Saley. After 4 years undergrad, can you apply for military medical school, or do you have to apply to military school now to get into the med school? That's a great question. So the benefit of doing military training is that they pay for your schooling, and medical school can be quite expensive. In order to get a ROTC, I think is the name of it, that kind of scholarship, you would apply at the end of your undergraduate training. So when you're applying for medical schools, you would still apply for med schools as if you're normally doing it, but then I believe you also submit and you sign up for ROTC. It's not an application, you just sign up for it. And basically you're making a commitment that after you finish your training, you'll be serving in the military as a doctor in some capacity for a number of years, and they'll pay off your student loans at the end of it. Yep.
Sorry, just a quick notice. I think this will be the last question because we're almost out of time, and then we'll conclude the meeting. So yeah, thank you everyone though. This is really good questions.
This last one is, are there any other specific courses that also need more dedication? I'm thinking you're referring to organic chemistry and other courses like that that are more challenging. I would say organic chemistry is far and away the hardest one. The rest of your courses, most people are pretty well acquainted with your biology, your physics, your chemistry, those kinds of things. And while they're not easy, I think that organic chemistry is kind of in a separate category. When you get into medical school, all of your classes become like organic chemistry. You're taking biochem, you're taking anatomy, and the same principles that will help you in organic chem will probably help you in those classes as well. Using flashcards, trying to actively learn and practice from memory, those kinds of things.
Okay, so thank you everyone. Thank you all for listening. Arnav, thank you so much. It's really great advice. So it's now time to wrap up the seminar. I hope everyone enjoyed from it and benefited from it too.
Okay, yeah. If anyone has any comments or suggestions on how we can improve our seminars, you can visit our website at prepinar.org where we have a suggestion form. And I can put the link into the chat right now. While I do that, I can let you know that you can use the form to request any topic that you might want a seminar for in the future. You can request any topic and we can try our best to fulfill that request and get back to you.
And please be sure to follow our social media accounts. I'll be putting a link down below that basically has all our social media accounts, Twitter, LinkedIn, and Instagram. And if you didn't have any questions answered, or you would like to follow up, you can use this contact form that I'm putting in chat right now, and you can we can follow up with you.
Yeah, we're really sorry that we didn't have enough time to get all of your questions answered. But yeah, as you said, you can use the contact form and we'll get back to you as soon as possible. So thank you, everyone.
Thank you, everyone.
Thank you, Arnav. Thank you, everyone, for joining. And yeah, we'll see you at our next seminar. Bye.
Bye.
Bye. Thank you, Arnav. Bye.